know, as Washington has failed to address this problem, you and your fellow governors have moved forward and stepped into the breach. However, one of the most controversial aspects of the plan that Governor Schwarzenegger just recently unveiled in California is his proposal that illegal immigrants be covered under his plan. How would you see, under your plan, bringing this very, very large segment of the population into the system or not?
They're children. We should cover children. We should cover children. As long as they pay their fair share with everybody else. An essential component of my plan is that we all pay, employers, employees, the government, but we help each other pay the fair share. The way you deal with immigration, one, yes, we have to secure our borders, no question about it. Not with this stupid wall that has been proposed. But you also set up a legalization plan for the 12 million undocumented workers that are in this country. Maybe it's not very popular, but it makes sense based on setting a path to legalization that involves dealing with issues like healthcare, that involves if they learn English, if they pay back taxes, if they pass a background check, they don't get ahead of the line of those that are trying to get here legally. These are children. We should insure all children in this country.
Well, we have a question from David Slater in our audience, who's taken a look at the kind of health care that Congress gets and wants to know why he can't have it too.
The governor brought up exactly my question. All members of Congress, senators, staff, postal workers are all in a great plan sponsored by the federal government. I was in that plan. I'm a retired postal worker. It's a fabulous plan. Why reinvent the wheel? We already have an existing system that can function. We don't need any more bureaucracy, as you mentioned. Just implement that plan to everybody here in this room and everybody as a U.S. citizen to have the same plan. As Senator Edwards said, he's comfortable. Every federal worker is very comfortable in their plan. Every postal worker has that plan. They have an option to pick from any insurance company they want. Why not just give it to the United States citizens right now? And as the governor said, that's something that can be implemented within 1 year.
Well, look, that's the cornerstone of my plan that deals with coverage. In other words, you know, the members of Congress, the president, they get the best plan in the world. They have all kinds of options. What I'm saying is offer that to every American, to every business, to every American family in that federal health care system. I totally agree with you. An excellent question. Thank you.
We also have a question by email from Ken in Olympia, Washington, who wants to know, how do you feel your experience as governor of New Mexico has prepared you to find solutions for the rising cost of health care and to achieve the goal of affordable health care for all? And if I could just add on to that, could you talk a little bit about, you know, what you learned? What parts of the problem, the health care problem, and dealing with it in New Mexico turned out to be harder to confront than you thought they were going to be?
As a CEO of a state, governors have to deal with this issue every day. And the most, I believe, innovative programs in this country are happening in the states in experiments to cover our people, all our people, and also control costs. As a governor, my approach has been, and my state is one of the highest uninsured. It's about 21%. 10% of those are Native Americans that are supposed to be covered by a federal health care system, and they're not. The federal government is abdicating, so we try to help with state programs. What we need to do is what we do in the states. I started out with a health care plan dealing with this access issue. Number one, we were able to insure all children under 5. Now we're trying to cover all working adults. The next phase will be, we will try to cover the chronically unemployed. But we have attacked the prevention issue aggressively, as I mentioned. We cut junk food out of schools. I I signed recently, last week, a statewide smoking ban. We should nationally give incentives to companies that give their healthcare workers time to exercise or an opportunity to build a healthier lifestyle. We should find ways also that in the American system, we encourage the American people to start earlier, early childhood, preschool. This is so important. School-based health centers at all our schools. But also recognize that it's going to take research. It's going to take efforts, aggressive efforts, to deal with deadly diseases, to deal with malaria, to deal with issues that relate to suicide prevention for children, to deal with issues that relate also for children that have sickle cell anemia, for diabetes prevention. We don't focus enough on prevention. And prevention, we spend 75% of healthcare costs on chronic diseases and only 5% on prevention. That should shift.
We also have a question from another SEIU member in the audience, Tracy Powell, who works for the Department of Family Services in Clark County and is really on the front lines every day of seeing another aspect of the healthcare crisis.
Good morning. I am a social worker for Clark County Department of Family Services, and I'm a member of SEIU. On a daily basis, we see how mental health services and substance abuse issues impact children and families. Typically, there's very limited resources for mental health. How would you address the mental health services and the care provided and coverage provided for mental health services?
Well, for years, mental health has been given lower priority in healthcare than almost any other problem. 1 out of 5 Americans has some kind of mental health problem, including schizophrenia and depression. And for years, in terms of insurance and coverage, we've neglected mental health. As president, I would not do that. What we did in New Mexico is we brought all mental health bureaucracy programs under one roof into what is called the Mental Health Collaborative. And we need aggressive efforts to include mental health in all types of coverage. We need to find ways also that we deal with substance abuse. You mentioned in New Mexico, in the West, in Nevada, right here, meth is the biggest problem. And we don't have answers in terms of how we can best treat it. If you're going to deal with substance abuse, mental health problems, alcoholism, what is critically important, not just law enforcement and incarceration, but treatment and education and investment in serious substance abuse programs that can make things better for you.